In health news, respiratory infections among young children have been on a sharp rise since the school year began in August. In fact, according to the CDC, in the past 6 months, emergency rooms have discharged an increasing number of patients who have what's associated with walking pneumonia or acute bronchitis. So joining me now is Dr. Natasha Bhuyan, National Medical Director of One Medical. I was looking at the statistics, and from ages 2 to 4, I mean, it more than looked like quadrupled. Why is that?
Yeah, so walking pneumonia, it's a type of milder pneumonia that we tend to see every year. It's caused by a bacteria called Mycoplasma pneumonia. And for a lot of people, it's very similar to the cold. And generally we see this in school-age children, but this year what's most alarming is we're seeing it in kids ages 2 to 4. The symptoms they're presenting with are different. Scientists are not exactly sure why, but it's likely because people are out and about, people are not staying at home when they're sick. And when younger kids get sick, they're more at risk for more severe illness.
Okay, so you talked about symptoms. What are we looking for?
Yeah, so the big thing is that it's similar to a cold, but it can last longer. So people might have fever, sore throat, feel fatigued, but it doesn't resolve after 3 to 4 days. It might persist for 7 to even 10 days. And so it's important to be vigilant of those symptoms. And then in younger kids, it can also present with they're not wanting to eat, they're really tired. Kids might also have things like vomiting and diarrhea, and so it's important to be vigilant of those symptoms. Now, the one thing I will say that is a bit alarming is because it can be confused with the common cold, it's tricky to diagnose. And also, we don't have good tracking mechanisms for this, so likely there are more cases of walking pneumonia out there in the community than we even realize.
Oh, that's very troubling. All right, so what can people do?
Yeah, the good news is there is a treatment for it. So there's antibiotics if people are diagnosed with this. The bad news is it's fairly contagious. And so the number one thing I tell people is if you have a cold or your child has a cold and it lasts longer than a few days, definitely see a primary care provider or a pediatrician. And then of course, if you or your children are sick, stay at home from work or from school because it's important for you to rest and recover, but we don't want you getting other people sick around you.
Yeah, especially when there's so many other respiratory illnesses floating around as well. All right, Natasha, thank you so much.